And that's what in our kitchen is shaping us, is giving us all the problem. Therefore, I think it's very important to start changing our life, and we need to change from today. And this is why I just put here healthy diet, balanced diet, regular exercise, walk. You know, our legs, they have the highest percentage of blood. The blood going to our legs is a large part of our blood circulation. It goes into our legs, and the muscles are very important. This is why by walking as well, you prevent your frailty when you get older. Because if you see elderly people, they are falling all the time, they're having fractures, they can't walk, they can't have, because we don't really invest when you are younger, when you don't look after your legs. How do you look after your legs? By walking. And by walking as well, and fasting itself is good. And I created something called fasted walking. And I just feel fasted walking, that is the healthiest way of doing things. It's because fasting itself, as I said, you know, the American or the Japanese one, they found that one Japanese Nobel Prize winner, he found that, you know, fasting helps the body to repair itself. They call a condition called autophagy, or الترميم الذاتي, self repair. This self repair, when you walk or when you exercise, you can increase it, you can multiply it by up to 10 times. Imagine that your body, because our body in the process of repair all the time. Even, you know, these cancer is developing our body all the time. If you have a good immune system, and if you have a good body repair system, which is done by the good immune system, then you can get rid of cancer cells, because the cells is moving all the time. Our body is producing cells all the time. But it gets out of control, we call it cancers, or we call it disease. Therefore, you are the one who can control it. And then we come here about...
Sorry, doctor.
Yeah?
You have a question.
Oh, sorry, question, yeah.
Sorry, it's all right, yeah. No, فيما يخص الدايت.
Yeah.
You know, nowadays people الناس مهووسة بحكاية الطيبات، نظام الطيبات اللي خص الدكتور ضياء العوضي. I'm sure you heard about it. The other side we have keto.
Yeah.
Just need your opinion on that. Which one you recommended?
I think I wouldn't recommend any other of this diet, because this diet, I always recommend to people suit what be suitable for you. الحاجة المناسبة لك أنت, you take it. Take the healthy one. This is why I create something called Al-Rashideen. Al-Rashideen system, which is mindful eating. Just be conscious. Avoid the things which are bad for you, which are called the white poisons. اللي هي الدقيق الأبيض, سكر أبيض, الملح. ثلاث حاجات. Very simple. And I tell you just to avoid this one, or you reduce it. If you take خبز every day, you take مخبوزات every day, bacalawas, cakes, biscuit, all these things. Just try to take one biscuit. You don't need to take the whole pack. So people they eat biscuit with tea. They bring in the packet like that, and they eat all day, because the manufacturer put all the tasty stuff there and the addictive stuff. Stop drinking juices. All these manufactured juices, and people they tell is natural, fresh food, fresh fruits. There's no fresh fruits in any juices. And as well, by doing the juices, by making a juice from an apple or orange, that is just you take off 90% of the benefits, because you throw the benefit in the rubbish and you drink sugar and water. And many people just think they are doing the right things, but unfortunately it's wrong. Drink water and eat the fruits, all the fruits with the skin. You know, that will help you, because there's 5%. There is all the minerals as well as the vitamins, they are in that part of the food. But you throw it away by just taking only the water and the sugar stuff. This is why a soda, Pepsi, Coca-Cola, and all these things, these are all addictives and they are causing problem. Even one can kind of damage your body. So this is, I think, we're talking about manufactured food, you know, industrialized food. And in the past, people, they don't have Pepsi or Coca-Cola or anything like that. They've been healthier. It's important that we have a regular check for the body, and then you have a better life and healthier longevity. Yeah. So it's really, really important. You need to move today before you become a number in the disease populations. I don't know if you have any questions so far, Ali?
How likely is it for people under 30 to get a stroke or high blood pressure? How likely is it for people under 30 to get a
Under
stroke?
30? Yeah, I think it's not common, you know, in the Western world. It's not that common. But people who have what you call familiar, you know, factors, or they have familiar stroke, you know, they come with a stroke. I've seen here, like in 20, 22, 23, 24, yeah, they had a stroke. Yeah, they come with stroke. Yeah. But it's not common. It is rare.
And
it's rare. But in Africa and the Middle East, we have people who have stroke, because we have rheumatic heart disease. That's a big risk factor for stroke in our communities. And as well, we have high blood pressure at early age. You know, we have what we call secondary hypertension, you know, high blood pressure. So we have that, yeah.
If a family has a history of...
Yes, family history is very important. People who have family history of stroke, they are more likely to have stroke as well. Yeah. This is why in my, you know, advice, in Taharruk, I said people who have high risk, high family history, parents, for example, they have a stroke, whatever it is, minor or big stroke, or any relatives, they have to check early age. And then I've seen...
My father has high blood pressure.
Yeah.
My mother had diabetes, so I should be on a high risk.
Yeah, absolutely. Yeah, this is why we need people to check. So we don't wait until it happens. This is why I'm saying, you know, at early age, you need to start checking your blood pressure. And then it's not that difficult, because everybody, I'm sure, got a GP here, family doctors, you know, you just need to make an appointment and say, oh, I just worried, you know, a family history of my parents, they have high blood pressure, diabetes, whatever. I wanted to check my blood pressure. Or you can just do it yourself. Check your blood pressure by just buying this machine, the device which is here. كان ارفع له جميل؟
نعم.
ارفع لهم الجهاز جهاز جنبه. هذا الجهاز called Emerald. That's very good. يعني but I'm going to bring mine. I've got my car. I will bring it. And we have this is mine. Yeah. يعني you can have a watch, which is the blood pressure. You can check your blood pressure, check your heart rate, and all this, even your sugar. Yeah. It's not very accurate sometimes, but could be indicative as well. So it might tell you.
Watches can...
Yeah. But there are good watches now. There are good companies.
Smartwatches.
With the AI, they are making good devices. Yeah. And I think we have, it's a good investment really. If you buy the good one, you know, probably cost maybe £100 plus, you know. But that is, if you put it against what's going to happen. Somebody have big disability. You can't walk, you can't talk, you can't move, you can't eat. That's a big thing, isn't it? That's life, isn't it? So if you invest well to invest in your lifestyle, that's the most important thing.
So you said physical exercise.
Yeah.
Like I do strength training. Is that something which helps, or you need to do like high intensity training?
No, when I would exercise, it's just half an hour to 1 hour of walking. Any other extra is going to be of benefit to the body, but walking is the best. Walking is the best, because walking, for half an hour, that's good. Sometimes I tell for people who can't walk, sitting on your chair, if you just move, make your movement. That's enough. Bring a bottle, big bottle, or like 1 liter or 2 liters, and then you put it up and down, 5-10 times. Just your leg like that, like that. That's movement. But as I said, we sit idle all the time. We just sit and eat, sit and eat. We don't do movement. People who work on computers from home or something like that, they sit on computers for 3, 4, 5 hours without moving, and as well keep eating. So at least if you work, at least every hour or every half an hour, just go for 10 minutes, come back. Yeah, it doesn't cost much. Even just around your desk, and then you just do some exercise. Little movement, it will make a big difference. Because you need to move your muscles, and then you burn these calories.
Question?
Yeah.
Jazakallah khair, Dr. Rashid, for the comprehensive talk about stroke and hypertension. There are a few old conception that we'd like to ask Dr. Rashid for his opinion on. I remember saying داء الفالج لا تعالج. With a stroke, there is no treatment and there is no way to get better. This is not true in the current science. So if doctor would in the old saying, they said داء الفالج لا تعالج. There is no. But now, if you have within the 4 hours or 4.5 hours, there are either treatment by intravenous treatment or embolectomy, which is not. They can introduce catheter, and they take the clot that had the stroke on, so which is very effective. And the other thing is many people say, well, I've been smoking for life, and my father was he died at 95 years of age, and he didn't have any stroke or hypertension. So why do you make it that much? So, so what do you think the answer for that?
Okay, thank you very much, Dr. Yassir. I think it's difficult really to say why somebody who smokes, is that just his body or her body, somebody smokes, but his body didn't really, there's something there, because really we don't know much, because وما أوتيتم من العلم إلا قليلا. مهما أنت, whatever you learn, you are not going to find out what is the cause of disease, but we can find the risk factors or the factors which lead to disease. But if we, for example, we have 100 patients, 100 people, we have 90 of smokers. 90% of them, they have, it's a probability. 90% they have the smoker, but they have disease. The 10% they don't have disease. It doesn't mean that, so I will follow the majority, the big, yeah. It's just probability. So I know there are some people, they might, that's what the Creator Allah gave them the body. They have some resistance for some reasons. People, for example, people who used to have, for example, in the past, HIV or all this COVID-19. Some people who have, they didn't have any problems. They are elderly, they are frail, they didn't have anything. While people who are fit, young people, they had COVID and they passed away. So, and people who had COVID, they resisted and they didn't have any problems. But some people, they end with disability. So it's difficult to say, oh, well. So that's it's just probability. Regarding the other question,
Another question.
about the embolectomy.
Yeah.
Yeah. So the treatment either we give the injections if you come within 4.5 hours, up to 6 hours, or up to 12 hours, depends on the clinician assessment. Then we will do catheters, but that is only in certain centers. For example, here in Birmingham, we have it in Queens. For example, we have to do in Newcastle, London, things like that. These are all 30 centers they have. You need to come in time. This is why once you say the ambulance, you call the ambulance, and they see that symptoms of stroke, tell them, oh, I think that I have a stroke, or I have facial weakness, or I can't move my leg, or somebody else call the ambulance and tell, oh, my husband or my wife sound like she fell, she collapsed, she can't move. Then the ambulance will come and they say false positive, and then they transfer, they convey that message to the hospital, the medical team, and they tell that false positive. When they say false positive, then they prepare the team, the stroke team, to be ready. And we are as stroke team, we catch the patient at the front door. We take the patient to the scanner just to make sure there is no bleed, and then we go for the injection. And as well, if the symptom is still there, doesn't get improved, we will do another scan just to inject contrast, just to make sure there is no obstruction. If we found there's a clot there, we will take the patient to theater, and then we will, with the catheter, we suck that clots, or we inject it, or we break it down. So, but most of the time we suck it out. This is what we call a condition called clot retriever. يعني هو إرجاع أو امتصاص الجلطة. But it's very important, this is why, and then we can save the cells, the blood will flow, and then the blood supply will go to the cells, and then we will get the survival of the cells.